had unlimited coverage. Preventive services were covered at 100% and no pre-existing condition limitations on all plans. However, we had that in California for most of our group plans anyway, so it's kind of a moot point. Some of the enhancements were a moot point. Mammograms were already covered. We already had a lot of routine preventive care covered. Yes, it was a copay, but the copays were usually pretty small, about $20. Wellness services were covered, contraception was covered. Ambulance services could be excluded, but it was very explicitly stated in the policy if it was excluded, and the employer chose that plan, and then usually would buy a supplement to pick up any costs outside of that if it made sense financially. So anyway, we would work around some of these exclusions for our employers. We could exclude brand name drugs if we had a young, healthy population that didn't want to cover brand name drugs because brand name drugs are so expensive. We would buy an additional policy for them to fill that gap. Anyway, we could get more creative prior to healthcare reform. So here I was stuck going to each and every employer. I actually even joked at one point with my boss that I needed a bulletproof vest because at some point I had an 88% increase. I had a 186% increase I had to present to an employer. And many times the employees were sheltered from these increases.